And so now I would love to introduce Dr. Cameron Cunningham. You may or may not know him. Dr. Cunningham is a physical medicine and rehabilitation specialist and a clinical instructor in the Department of Medicine at the University of BC. So welcome, Dr. Cunningham. How are they doing with that?
Okay. Can you guys hear me okay in that? Okay. Thanks so much to the organizers for inviting me. Unfortunately, I can't stay the whole day. It's a bit of a busy weekend for me. It's my parents' 50th wedding anniversary and my daughter's 6th birthday. So I speak pretty quick after. But the schedule looks amazing, and I'm so glad that we have a conference like this. So I think it's excellent that this is happening. So I have a clinical practice in physical medicine and rehab in Vancouver. I work at a GSR rehab center and medical manager of our neuromusculoskeletal program, which sees people with neuromuscular disorders. So some of you may have connected with that program or myself in the past. And then I also have a community practice in Westminster as well, where I see lots of different conditions, but I do see folks with neuromuscular disorders, FSHD. So, the topic today was really talking about, multidisciplinary or interdisciplinary care with FSHD, right? And I think, as you all know, it's a muscle disorder, but it doesn't just affect muscle, right? It really impacts like all aspects of life. And I think that, with that, no single provider is going to be able to provide all the answers or be able to kind of help you optimize things as best as possible. So you really do need a team-based approach, right? And the hope with that is that people can build self-efficacy in terms of their managing things as best they can on their own, improving and maintaining function mobility, as well as kind of building towards long-term quality of life. And then also I think a team-based approach to support, which would be about assessing outcomes from different potential treatments as they come along. Right? And so the core team members of Summit's team, and probably some of these will look familiar, but often there'll be sort of some medical specialists involved in that kind of team. That might include neurology, physiatry, perhaps respirology, and others. And then sort of more allied health roles, including physiotherapy, occupational therapy, orthotists, sometimes speech language pathologists, etc. So, and I think the kind of core of the team obviously is the person seeking care, and then really we're trying to build the team of appropriate individuals around that person to provide the best care possible. So in terms of kind of medical care, at least I can speak locally. Obviously my practice is biased towards the Lower Mainland, and so I can speak most to that. But it's essentially kind of having a family physician involved as well as it is key. I know it's harder and harder, unfortunately, to have access to that locally, but a family physician or primary care provider is an essential ingredient over looking after overall health. And then building from that, often people would be involved with neurology, physiatry, and/or physiatry, respirology, and etc. And depending on where someone lives in BC, there might be some local access to appropriate specialists, or sometimes it does mean either virtual or in-person visits like coming to the Lower Mainland for the more subspecialty kind of care. So I think many people probably know what a physiatrist is, but some people don't. We're kind of like a little bit of a not as well known specialty in medicine. So often when I introduce myself as a physiatrist, they think I'm a podiatrist and they're asking to show me the feet, or they think I'm a psychiatrist, and they want to talk about things that are still fall within things I asked about, but maybe a slightly different approach. So I think the thing that's kind of unique about physiatry is we're kind of one of the few specialties that's not attached to one body system, right? We're kind of trying to take a bit of a holistic approach to someone's function and quality of life. And then we're tailoring things to that individual, right? So we're kind of customizing a plan based on what that person needs. And often the things we are trying to try and work on or optimize is, providing some education, again, kind of on that sort of self-management and trying to make sure we're doing the things that we can do to try and help ourselves. Things to try and optimize mobility, and in some cases, managing fatigue or fatigue or pain symptoms. Sometimes we get other orthotics, other equipment to try and optimize function. And then with that, we often are working with other providers or health team members to try and accomplish some of those goals. Sometimes that means referral or bringing in other individuals as well into the team. So again, the allied health team, and these can be quite varied, and again, are kind of specific to what the kind of issues are and what we're trying to address. But instead, a little slide on physical activity. I'm spending a lot of time talking to people about physical activity, as you might imagine. And there's some people are often curious about what they should do or could do, or what is the benefits of it. I think people generally feel that there's benefit and they kind of know that. And but sometimes we're trying to be creative about, okay, well, how can we kind of accomplish some of those goals depending on someone's level of function or what kind of aids they use. I think some of the key components we're often thinking about with an exercise program, obviously focus on more aerobic or cardiovascular conditioning, some resistance or strengthening type exercise, and then some of the other things that are more mobility or flexibility of the body, and then balance or stability. And often kind of, when we're discussing it, I often kind of tell people like the consistency over time is probably one of the most important variables. And like, this is not a test you can cram for, right? Like you can't just like, I'm going to go really hard and then like next month you're going to be better. Like, it doesn't work like that. And so I think the more we can kind of build in strategies that are part of our day-to-day life, it's part of our routine, and it's just something that we're doing over time, like really over years, I think the better off we are. Now, that said, I do also, when I'm discussing this with people with neuromuscular disorders that might be progressive, I often put the caveat, I don't see it as a personal failure if something changes or progresses despite all those efforts, right? Because we're trying to optimize things, but like it's not someone's fault that, oh, I've got a little bit weaker here, right? This is not the fundamental problem is not effort. It's that there's a muscle disease, right? So I think there's always a bit of a balance in that discussion, right? Where you can't can't completely effort your way through the issues. But one of the things I put the little tachometer on there is that I end up using, you kind of find that analogies that kind of click for you at least, and then I don't know if they click for other people, but with aerobic training, I think about if we're training our aerobic system to be more conditioned, then essentially if people have a pattern of weakness and they're doing a compensation pattern all the time to carry out a task, they're going to be inherently less efficient at doing that task, right? And so if you imagine your RPMs are going to be revving a bit higher all the time to do a certain task. And so you're less efficient with that. But if we train the cardiovascular system, we can kind of move the yellow or red zone on that tachometer a little bit further along. So we're not kind of totally getting into that zone with the stuff we need to do in our day-to-day. So sometimes doing that cardiovascular conditioning can have payout in terms of how long someone can tolerate an activity, or maybe able to do something a little bit better. And then of course, big picture with physical activity, like if we can, we're looking at injury prevention, fall prevention, because I don't know, I'm sure we've all experienced setbacks in life, but I see a lot of folks who, if they get an injury and on the background of some muscle weakness from FSHD or other neuromuscular disorders, it can take a big step back, and sometimes it's really hard to get around again. And so I think that we do have to kind of take a preventive approach with that also. So physiotherapy, at least locally, there's not that many people that have just like endless funded physiotherapy available, right? So most of the time, physiotherapy is short to medium term goals based. Like, what are we trying to accomplish? Here's the specific goals, and that might be around some of those things I was talking about before, or treating a secondary injury should something have occurred. And options for that are often through private physiotherapy, which might be more like neurophysio, which often people have a bit more training and expertise in neuromuscular disorders. And then depending on different health authorities, they'll have often an outpatient rehabilitation program that would be, again, sort of that short to medium term for a goals-based intervention. Yeah. And then occupational therapy, some people may be very familiar with occupational therapy, some people might not be as much so, but occupational therapists are a little bit Swiss Army knife like in terms of like they're looking at strategies and adaptive tools for addressing grooming daily activity or transfers. Can be very helpful with pacing and energy management strategies if that's relevant. Looking at some home environments, any equipment that might be helpful to promote independence or safety. And again, kind of locally, we would kind of have a home care occupational therapist, which we refer out to for some of the home-based interventions. And then there are some outpatient occupational therapy available through the health and rehab programs. And then again, sort of private options as well. Now, there are orthotists or specialists in making kind of external aids to try and promote mobility. And so sometimes we're looking at bracing for, if someone has a bit of a foot drop or weakness around the ankle, see if we can improve clearance or walking. Some of the technologies advancing to try and work on more scapular stabilization orthoses, such as the one shown here, which are often, can be sort of 3D printed and kind of some of the technologies kind of getting better in that regard to hopefully make them more kind of functional and useful. And then depending on relevance, if there's any facial weakness, swallowing difficulties that people experience, then sometimes we'll have an SLP involved. Or again, if there's any concerns about breathing muscle strength, and sometimes respirology or respiratory therapy, as well as sometimes we'll get sleep studies for just ruling out things like sleep apnea. So, and I think the other important part that I always think about is, again, it does have, having a muscle disease impacts lots of areas of your life. So we want to make sure that we're also supporting someone's mental health. And sometimes it is managing with adjustment or kind of coping with changes, right? And I know I've had some people describe to me they feel like sort of grieving successive losses sometimes in terms of like, hey, I can do that before, but I can't, and kind of feeling a bit of a shifting kind of background is hard, right? That's not an easy thing to manage and cope with, and so I think supporting that aspect I think is really important. And then again, if as relevant, involving medical genetics or genetic counseling, particularly in family planning or support that way. Mentioned already the primary care provider, but obviously we want to make sure we're looking after someone's general health and making sure they're healthy in the long term as well. So it's super key to make sure we're routine screening for all other non-FSHD related things. And then sometimes we'll have other groups involved, social work, dietitian, sometimes guidance on healthy weight or muscle mass maintenance, etc. And then often we're kind of in our business just kind of planting the seed about the CMDR, which I know Dr. Parkhouse can talk more about, but just so people can have a bit of awareness about how to link in with that if they're interested in participating. So, I think the nuts and bolts of the kind of working with an interdisciplinary team can be, obviously it's important to have shared goals and communication. We have been working on trying to develop some multi-specialist clinics locally. So in New Westminster, in our office there, we started a clinic that's myself and a neurologist and a respirologist, where we can kind of see everybody in one visit. So that has been kind of a useful thing for people. I think they find it's a couple less doctor's appointments in over the course of the year, which is useful. And I think from the provider standpoint, it's super helpful because we can review where some of the issues are or intervention that we want to try and target. And then I just wanted to also emphasize that you're the most important part of the care team. And so I think the more people can identify, what their goals are, preferences, what the challenges are, the more you can kind of drill in on those, the more often you can kind of try and put some things that are useful, right? And it's sort of one of those things that develop those in the details. And sometimes it's, there are things that we can do to try and help when we kind of fully understand the issues. So I guess my key takeaways was, obviously I think FSHD is certainly a condition where it's best managed with a team approach. Every specialist is going to have a bit of a unique role, but I think the more we can try and develop a cohesive team around someone, the better off we are. And even your families are active members of the care team. And I definitely find, particularly with FSHDs, like there's no one size fits all approach. You know, it's like you really have to like figure out what's going on with each individual and try and find the strategies that can be helpful. And I think, yeah, the kind of number of people on that team kind of expand and contract depending over time where the goals are. So I'll answer any questions from our favorite time, and then just want to put a quick note if you haven't seen a physiatrist or like, oh, hey, how do I get referred? The neuromusculoskeletal program at GS Strong does cover the whole province for physiatry. So if you're like, hey, I've never seen a physiatrist, maybe they have something offered. You just need a physician to refer. It could be your neurologist or family physician. There's on the website, there's just a referral form that can be sent in. There's also many great outpatient physiatrists in the community that might be close to home depending on where you are. And then that interdisciplinary neuromuscular clinic is the clinic that I mentioned before that we started in Westminster that will take referrals from any you just need a medical doctor to send a referral or a nurse practitioner, I should say. And that's in that clinic, it would be a combined visit with neurology, which is Christine Stables, and the respirologist Sean Hong to do sort of a combined visit. So I think that's all the slides.
Awesome.
Okay. Do you have a quick question?
Questions? Anyone?
Question on your aerobic exercise, how much are you still recommending to your patients and those that have FSHD that can't really, do a lot necessarily, like walking or maybe running is out of the question, so jogging out of the question, maybe walking's kind of there, but how do you guide that?
Yeah, so the question just around, what kind of volume are we looking for, and then how do we guide if, particularly if walking is maybe more challenging and maybe not always practical, maybe for a longer form of physical cardiovascular exercise. I think I probably prescribe a lot of cardiovascular activity that maybe is like walking is usually the goal we want to maintain, right? And so we do want to do some degree of walking to try and focus on that specific goal. In terms of just the cardiovascular training, sometimes we do need to find something that's like, either like a arm or leg ergometer or something like that, like a little pedal bike, something like that, that allows people to get their heart rate elevated and maintain at an elevated kind of level for more continuous basis. Particularly people find they tire up pretty quickly with walking, you kind of get heart rate up for a few minutes and then you have to kind of stop. And so it's kind of like trace your heart rate data and kind of go up and down. So we're trying to find something new that gets something more steady state for a longer period of time. And so, yeah, that might be looking at other strategies to try and accomplish that. And then, in terms of exact volume, sometimes it's a bit of nuance there, just in terms of like, we have to figure out where someone's at right now, right? And then try and slowly increase, like, there are some recommendations, 3 times a week, cardiovascular activity with FSHD that's seen, Canadian physical activity guidelines are more like 150 minutes a week. But then you have to start where you are and then try and just slowly build up, right? And see where can we get that to, right? Where does the field good? Where we're building some endurance, but not overly tiring or over making us overly sore, things like that, right? So we do end up kind of personalize it quite a bit. And I guess I would usually, if people are really on just trying to make some changes, then I would say just focus on just the consistency part, like more frequently for over duration or intensity, right? At the beginning, it's just try and make it happen more often, right? If you already tolerate 10 minutes of walking now, then just try and build that in more routinely and to see what kind of volume something can add. Just doing that alone is sometimes that's quite a bit, right? If you can add up what you're doing in a week. So, sorry, a bit of a vague answer, but yeah.
Yeah.
Okay, so you want to